My name is Genevieve Ellis. I work with the Coalition of Community Health Clinics, and we're a nonprofit organization that is a network of 14 safety net clinics in the Portland metro area. Our clinics provide affordable, high quality, culturally appropriate care to community members who are uninsured and underinsured, and who oftentimes cannot access care at other locations. So a lot is changing with the Affordable Care Act and with Medicaid expansion. And our clinics have had to think a lot about how their patient populations will change and how their business models will change based on these new regulations and opportunities. And so we have a mixture of federally qualified health centers that receive federal funding and community-sponsored clinics or safety net clinics, oftentimes free clinics, that charge a nominal fee or a donation for their services and primarily see uninsured patients. Our clinics have had to do some soul searching, essentially, thinking about their mission and how many people will be remaining uninsured, and also many of them have very close connections to the community members that they serve. And so these patients want to continue seeing their providers at our clinics, and they have established relationships with them. And so our clinics have to think about how can we continue to see the patients that we've been providing care for even after they get insurance. Primary care is essential for ensuring that people can stay healthy. Of course, there are social and environmental determinants of health that impact people's ability to live healthy lives. But primary care and the ability to have a relationship with a provider that you know and trust, and to be seen regularly so that you can catch issues before they turn into bigger problems is really huge. Investing in primary care and really strengthening, especially the safety net, is so important right now, so that we can ensure that all these people that are newly insured can access care to help them, keep them out of the emergency rooms, keep them from their chronic conditions from worsening. So many of our clinics have established themselves within certain communities, and these communities know that they can go to them to receive culturally appropriate care, and they know that they can trust the providers there who have been serving there for many years. And so it's kind of a niche relationship that our clinics have with these patients, to where the patients may not get the same care at a larger hospital system or with a private provider. They don't have those relationships. For example, North by Northeast is a small community-sponsored clinic that is located in Northeast Portland, and they are very grounded in serving the African American community. And historically, there has been a lot of mistrust of providers within that community, for good reason. And so for North by Northeast to have that relationship with these community members is really, it's essential, it's important, and the trust is there, the cultural humility is there, the high quality care. Many of our clinics also serve other populations. For example, Outside In specializes in serving homeless youth. And again, when you're talking about homeless youth, there are a lot of barriers to seeking care. For example, you may not want to go into a clinic where you could be identified and your parents could be notified. Outside In has made sure that their staff is culturally competent in serving that population. So one interesting thing that the coalition has done is we have integrated clinics that do traditional Western allopathic medicine, and those that provide naturopathic, Chinese medicine, acupuncture services. And this has been a really great collaboration. Many of our complementary and alternative naturopathic care clinics actually serve within our Western allopathic clinics. To be able to tell someone, none of our clinics prescribe opioids, but they can offer you alternative methods of treatment for your chronic pain. We recognize that it is a real problem and that you are feeling pain, and so we have acupuncture, we have herbal remedies, chiropractors. We have the University of Western States that does chiropractic care and collaborates with a number of our other clinics to provide those services within someone's primary care home. I do think that one important point to highlight is that there will be people who remain uninsured after Medicaid expansion. And many of our clinics currently provide services only to uninsured populations. And they've had to look at their business models to see if it's going to be feasible or whether they'll have to start billing, whether they continue to be a free clinic. But it's also very important to recognize that the uninsured will still need to receive care, and that's necessary to be able to provide primary care to that population so that we can make sure that they are not going to the emergency room, with really terrible conditions. Our coalition, especially our central office, provides a lot of information, access, and referral for patients who are looking for primary care or for specialty services. We have been doing a lot of work around Cover Oregon application assistance. We also advocate on behalf of our clinics to make sure that their voices are being heard in this larger landscape of healthcare transformation. I think we have a really unique and interesting process that's taking place in Oregon right now with our coordinated care organizations. And we just want to make sure that that is really a collaborative model and that we're taking into account all of the unique insights that our clinics have. Our clinics provide care to 60,000 people in the Portland metro area, and that is no small number. I think it's almost 300,000 visits in the last year. Many of them, over a third of them, from communities of color, many from homeless populations, LGBTQ populations, and other marginalized and hard to reach patient populations. It's great to be able to offer Portland such a strong safety net, especially around primary care, because it's so essential.